I said before, if your situation with your heart or your brain is not particularly stable, make sure you consult with a physician first before you get into that high intensity mode. The second type of exercise which has been shown to improve blood pressure is isometric exercises. Isometric exercises are the kind of exercises where you don't move. You basically keep still. This could be yoga, Pilates, doing a plank, doing a standing wall squat, even doing grip strength exercises is maintaining that. Something interesting about maintaining a muscle contraction, which makes your body want to dilate blood vessels and improve your blood pressure. This was a study which showed significant reduction in blood pressure in those clients who did isometric exercises. What is level 5? Reducing homocysteine, which is a particular amino acid. Homocysteine is a particular amino acid which has been shown in studies to increase the risk of a blood clot. And there are two main ways in which homocysteine levels go up. One is by having low B vitamin levels. If you have persistently low levels of B6, B12, and folic acid, that increases your homocysteine levels and increases your risk of getting a blood clot. The other way that you can raise your homocysteine levels is by smoking. Smoking also increases homocysteine levels and increases risk of a blood clot. And so number one, ensuring that you take a daily multivitamin, take an extra B complex if you like, and if you've ever had a history of vitamin B12, you should probably take at least 5,000 mcg of sublingual vitamin B12 once a week for the rest of your life. Don't worry about taking notes. You have a whole blog on vitamin B12. If you smoke, you really should stop smoking. This is a study which showed that when a person smokes, not only do they increase their homocysteine levels, they also end up reducing their B complex vitamin levels. Smoking seems to reduce your absorption of vitamin B, and through a combination of increasing homocysteine levels and reducing your levels of folic acid and B12, smoking increases your risk of a blood clot and your subsequent risk of stroke. So stop smoking. This was a White-Cox study, which was really, really interesting. The White-Cox study was a really interesting study. As we get older, our brain starts shrinking, but by taking regular B vitamins, you can slow down the rate of brain shrinkage and memory decline. But there was another part of this White-Cox study which showed that omega-3 had a further accelerating effect on slowing down the rate of brain shrinkage. And I have a little bonus tip here at the end as well, that if you are overweight, then reducing your blood pressure can be achieved also by essentially losing weight. Of course, there are various ways of losing weight: calorie restriction, calorie tracking, changing your diet. Intermittent fasting is also an effective way of losing weight.